Hey there, health warriors! In healthcare, protecting patients and staff from infections starts with one simple principle: isolation precautions. Whether you're caring for someone with C. diff, flu, or tuberculosis, understanding contact, droplet, and airborne precautions is essential. Today, we're breaking down the types of isolation, what PPE you need, and the right way to enter and exit a precaution room. Let's go! Isolation precautions are critical measures used in healthcare settings to prevent the spread of infectious diseases. These precautions are divided into three main categories: contact, droplet, and airborne. Each category requires specific personal protective equipment, or PPE, and protocols to ensure the safety of both healthcare workers and patients. In this section, we will delve deeper into each type of precaution, detailing when and how they should be implemented. By following these guidelines, we can significantly reduce the risk of infection transmission within healthcare facilities. Why isolation precautions matter. Infectious diseases can spread quickly in healthcare settings. Isolation precautions help prevent the spread of dangerous pathogens, protect other patients, visitors, and healthcare workers, ensure compliance with infection control standards, and reduce outbreaks and healthcare-associated infections, or HAIs. These measures are essential for maintaining a safe environment for everyone in the healthcare facility. Each type of precaution is based on how the infection spreads by contact, droplets, or airborne particles. Contact precautions are used for infections that spread through direct or indirect contact with the patient or their environment. These include MRSA, VRE, C. diff, scabies, norovirus, and wound infections with drainage. By adhering to contact precautions, we can effectively control the spread of these infections within healthcare settings. Now let's talk about contact precautions and what you need to do. First, always wear gloves and a gown every time you enter the room. It's important to remove your personal protective equipment before exiting. Also, make sure to clean and disinfect equipment before reuse. Whenever possible, use dedicated or disposable equipment. And of course, perform hand hygiene with soap and water, especially for infections like C. diff. Moving on to droplet precautions. These infections spread through direct contact or contact with contaminated surfaces. Droplet precautions are used for illnesses like influenza, COVID-19, depending on procedures, RSV, mumps, pertussis, and meningitis. So what do you need to do for droplet precautions? Well, you should wear a surgical mask within 6 feet of the patient. If there's a chance of splashing, add eye protection. Try to place patients in a private room if possible, and when transporting the patient, have them wear a mask as well. Alright, let's talk about airborne precautions. These are essential for preventing the spread of certain diseases. So, what are airborne precautions used for? Well, they are crucial for conditions like tuberculosis, measles, varicella, SARS, and COVID-19, especially during aerosol-generating procedures. Remember, droplets travel short distances when patients cough, sneeze, or talk. Masks are vital in protecting you from exposure to these airborne particles. What you need to do: wear a fit-tested N95 respirator or PAPR. Place the patient in an AIR or airborne infection isolation room with negative pressure. Keep the door closed at all times. Limit patient transport. If transport is necessary, have the patient wear a surgical mask. Airborne particles can stay suspended in the air for long periods. Respiratory protection is key. Standard precautions apply to everyone. No matter the isolation type, always use standard precautions. Hand hygiene before and after patient contact. Use gloves with blood, body fluids, or mucous membranes. Mask and eye protection if splashes are possible. Safe handling of sharps and contaminated linens. These precautions apply to every patient, every time. Isolation room etiquette. What to remember. First, read the sign. Know what type of isolation you're entering and gear up accordingly. Second, don PPE in the correct order: gown, mask or respirator, goggles or face shield, and then gloves. Third, remove PPE carefully. Gloves, goggles or face shield, gown, and then mask. Perform hand hygiene immediately after. Fourth, educate visitors. Ensure family and friends understand PPE use. Limit visitors when necessary based on policy. Infection control is everyone's responsibility. Whether it's contact, droplet, or airborne precautions, knowing the difference, wearing the right gear, and following protocol helps keep our patients, coworkers, and communities safe. What's one tip your team uses to stay compliant with isolation precautions? Share it in the comments. We're all in this together. Like this video? Give it a thumbs up. Subscribe for more infection control, clinical skills, and healthcare safety training.